Welcome back. Today, we're diving into an important health topic: foods that can be detrimental to prostate health. Whether you're looking to maintain a healthy prostate or you're simply interested in better dietary choices, this video will shed light on what foods to perhaps avoid or consume in moderation. Let's first cover what is prostate cancer. Prostate cancer is a type of cancer that occurs in the prostate, a small walnut-shaped gland in men that produces the seminal fluid that nourishes and transports sperm. It often grows slowly and is initially confined to the prostate gland, where it may not cause serious harm. However, while some types of prostate cancer grow slowly and may need minimal or no treatment, other types are aggressive and can spread quickly. Who is at risk? Prostate cancer is predominantly found in older men. It is rare in men younger than 40, but the risk increases dramatically after the age of 50. About 60% of cases are diagnosed in men aged 65 or older, making this the most significant risk factor. Other risk factors. Family history. Men with a family history of prostate cancer are at a higher risk. Race, ethnicity. African American men have higher rates of prostate cancer diagnosis and are more likely to have aggressive tumors. Lifestyle and diet. Diet, obesity, smoking, and exposure to chemicals can also influence risk levels. Let's jump into the foods to avoid and the less obvious foods they are found in. Red and processed meats. Red and processed meats like bacon, sausages, and hamburgers are high in saturated fats and have been linked to an increased risk of prostate cancer. Studies suggest that high consumption of these meats can lead to inflammation and hormone disruptions that may adversely affect the prostate. Hidden sources. Apart from obvious sources, processed meats can also be found in items like frozen pizzas, canned soups, and ready-to-eat meals where they are often used for flavor enhancement. Dairy products. Regular consumption of high-fat dairy products can raise the body's level of calcitriol, the active form of vitamin D, which can stimulate prostate cancer cells to grow. Items like whole milk, cheese, and butter are particularly high in fats that are linked to poor prostate health. Hidden sources. Dairy is commonly hidden in baked goods, creams, whipped toppings, and even in some non-dairy creamer products, making it crucial to read labels carefully. Alcohol. Excessive alcohol consumption has been associated with an increased risk of prostate issues. Alcohol can affect the balance of hormones, including testosterone and estrogen, and is also a known risk factor for cancer. Hidden sources. Alcohol isn't just found in beverages, it can also be a component in mouthwashes, some desserts like tiramisu, and used as a flavor enhancer in luxury sauces and marinades. Fried foods. Foods that are deep fried, such as French fries and fried chicken, contain high levels of carcinogens and toxins like acrylamide, which emerge from cooking oil at high temperatures. These compounds can promote inflammation and potentially increase cancer risk. Hidden sources. Acrylamide is not only found in fried foods but also in cigarette smoke and home-cooked foods like toasted bread and roasted coffee beans. Hey there, are you finding this video helpful? If so, why not subscribe to not miss our latest videos? Sugar-sweetened beverages. Drinks high in sugar, such as sodas and fruit-flavored drinks, can lead to weight gain and obesity, which are known risk factors for prostate cancer. High sugar intake also causes spikes in insulin and changes in other growth factors that influence cancer growth. Hidden sources. These sugars are not only in drinks but can also be found in condiments, salad dressings, and breakfast cereals, which often contain high fructose corn syrup. Non-organic vegetables and fruits. Non-organic produce may be contaminated with pesticides and chemicals that can affect hormonal balance and overall prostate health. Some pesticides are known to act as xenoestrogens, which can mimic the action of estrogen, thus disrupting hormonal activity. Hidden sources. Besides fresh produce, these chemicals can be found in frozen products and juices that are not certified organic. Canned foods. Many canned foods contain bisphenol A, BPA, a chemical shown to interfere with hormone function. Exposure to BPA is linked to an increased risk of prostate gland abnormalities and cancer. Hidden sources. BPA is not only present in canned food linings but also in some plastic containers and water bottles, making it vital to look for BPA-free labels. Salt. High salt intake is not directly linked to prostate cancer, but it can exacerbate issues like an enlarged prostate by increasing water retention and swelling. Excessive salt can also harm overall cardiovascular health, which is important for maintaining optimal body function. Hidden sources. Excessive salt is often found in processed foods, ready meals, and even some snack foods like pretzels and chips. Artificial sweeteners. Artificial sweeteners like aspartame and saccharin are often used as sugar substitutes but can have adverse health effects. While research on their direct impact on prostate health is limited, these compounds have been associated with causing bladder irritation and have been controversially linked to cancer risks in some studies. These sweeteners can disrupt the body's natural hormonal balance and overall metabolic processes. Hidden sources. Commonly found in diet sodas, sugar-free gums, and diabetic-friendly desserts. Artificial sweeteners are also used in many low-calorie or calorie-free products to enhance sweetness without adding actual sugar. Hydrogenated oils. Hydrogenated oils, also known as trans fats, are a type of unsaturated fat that has been chemically altered to increase shelf life and stabilize the flavor of foods. These fats are associated with inflammation and long-term health problems, including heart disease, which can indirectly affect prostate health by impairing blood flow and hormone regulation. Hidden sources. Trans fats are often hidden in margarines, snack foods, packaged baked goods, and many fried foods. Although many countries have regulations to limit their use, they can still be found in small amounts in various foods. Prevention strategies. Besides family history, specific genetic mutations, like those in the BRCA1 and BRCA2 genes, which are also linked to breast and ovarian cancer in women, can increase the risk of prostate cancer. Discussing genetic testing might be relevant for those with a strong family history of cancers. Regular exercise has been shown to help reduce the risk of developing advanced prostate cancer. Beyond avoiding harmful foods, emphasizing the benefits of a diet rich in fruits, vegetables, and whole grains, which can potentially lower the risk of prostate cancer, would be beneficial. Exposure to certain chemicals, like those used in farming and some industrial substances, have been linked to a higher risk of prostate cancer. The psychological impact of a prostate cancer diagnosis and the stress associated with chronic health concerns can affect overall health and quality of life. Discussing the latest treatments for prostate cancer, including minimally invasive surgery options, radiation therapy, and new medications, can provide hope and detailed information for those affected or at risk. For less aggressive cancer, active surveillance or watchful waiting might be an option. This approach avoids or delays the need for treatments like surgery or radiation. Advocacy and support. Encouraging men to participate in support groups and advocacy networks can empower them and provide essential support. Understanding what to eat is just as important as knowing what not to eat, especially when it comes to maintaining a healthy prostate. We hope this video helps you make more informed dietary choices. For more health tips and insights, don't forget to like, subscribe, and hit the notification bell. Stay healthy and see you in the next video.